So what we do here at the poster is we analyze the ALSFRS-R score. So the ALSFRS-R is a common outcome in clinical trials, but there are also many papers already about it that there's things going wrong with it. So what we know is that the ALSFRS-R is actually based on 4 different domains. So you have like the bulbar domain, you have the fine motor, you have the gross motor, and the respiratory domain. What happens actually is that we sum up those domains, and this makes up the score of a patient, but it doesn't mean that it makes sense to do that, because some patients have only bulbar symptoms, and if you add 3 other domains to it, you actually dilute like disease characteristics of patients. So what I do here at the poster is I take those 4 domains back, and then look at the at diagnosis, or maybe at when the patient comes into the trial, I'm going to look at what actually are the symptoms of the patient. So if the patient only has bulbar symptoms and fine motor function symptoms, I'm only going to follow up those 2 domains over the course of time. And the other questions I just disregard. So what we find actually, if we do this kind of approach, the measurement becomes much more sensitive to disease progression. So for clinical trials, it would mean that we can see treatment effects much faster, or we can reduce the sample size, so less patients need to be on placebo. We can do smaller trials, make it cheaper. So that's really a new method to look at the ALSFRS-R score.